Here are three of our young rats, Chloe at the front, Ellie in the middle, Amy at the back, and they've just been joined by Sophie there. Now unfortunately rats do get a lot of health conditions, and some of them are very nosy, aren't they, Sophie, as well, just to see what's happening. But it is quite serious and worrying, but just get to know the symptoms of illness and when to take your rats to the vet. Now the first sign of any illness or pain or stress in an animal, or in a rat, is the porphyrin staining, the reddy brown staining that they get around their nose and eyes. Sometimes if you're a new rat owner, you may panic and think your rat is bleeding, but you have a closer look and you'll see it is just a staining. But this is a sign that you need to keep a close eye on your rat and find out what's going on, and get them to the vet and see what's happening if there's any other symptoms. But upper respiratory tract infections are very common in rats, and they start in the nasal passages, but they can spread to the lungs and turn into pneumonia quite quickly. You also get chronic respiratory disease, which is usually the Mycoplasma. That has a long name, which I'm going to put up on the screen so you can do some research of your own. But that's bacteria which is present in the cells of rats and mice, and it's believed that all rats and mice have this from birth. It never goes away, but it will lie dormant in the body, and then during times of stress or when the immune system is compromised or weakened due to another illness, then it will flare up and the rats will get very wheezy, noisy breathing, some discharge from their nose, they can be coughing or sounds like they're choking, and that very bad sneezing usually, and it can turn into pneumonia very quickly. So with all respiratory tract infections you need to get antibiotics very quickly from your vet, because pneumonia kills. Now usually you'll get Bactriol, which is a liquid antibiotic, and quite often you'll get a tablet antibiotic as well, and the tablet will vary depending on your vet and whether the first lot of medication works or not. And it's a minimum of 7 days, but quite usually you'll find a rat with Mycoplasma will be on antibiotics for a lot longer than that. It is very tricky to treat, and it will spread from rat to rat, but it won't spread between humans and rats, so you don't have to worry about that. But we tend to find whenever one of our Mycoplasma rats will get a flare-up, it will spread to all the others that have the weakened immune system, but it tends not to affect the healthy ones. So it is one of those nasty diseases, and it's lifelong, so you'll be constantly treating the rats. If your rat is under 3 months and develops sort of symptoms of wheezing and sneezing, it's more likely to be a virus, and there are a lot of viruses around. Now, viruses don't usually kill rats, but a secondary bacterial infection can. So yet again, if your rat is at all unwell, visit the vet. There's a very nasty one called the SDAV virus, and that can spread very quickly through whole colonies and kills rats quite quickly. But we've never had that, although I know people that have. And then of course you might have heard of the hantavirus, which spreads between wild rodents and humans. I've never known anyone with a pet rat who's ever caught anything from their rat, ever. So I don't think you should worry too much. Just worry about what's wrong with your actual rat and treat the rat. And all these respiratory infections are spread airborne through little droplets. So the rat will sneeze and little droplets will come out, and then someone else will breathe it in. So we find that trying to prevent the infection spreading to other rats is a good thing to try and do, and that's just by washing our hands before and after we handle sick rats, ventilating the room every day. We keep the temperature comfortable, around about 18 degrees. We keep food and water bowls very clean, plenty of fresh water, remove all dirty bedding every day. If you have fleece, you'll need to wash it a bit more often than you normally would at 40 degrees to get rid of any germs. We avoid spraying any chemicals or aerosols near our rats, because if you've got breathing problems, that's going to make it a lot harder for you to breathe. And I think we always wash down the shelves every day with just some hot water, and just make sure you do a very good clean every day and every week. And once a month, a really deep clean of your cage. And if rats have been sick, we'll do the deep clean more frequently. Just take everything apart, give it a really good wash. And we've got lots of videos on cleaning, more coming up as well. So the other thing that can cause a little bit of sneezing and some clear discharge is allergies, and they're usually environmental factors, so they're not really illnesses as like an infection, but it could be caused by dust in paper. Even some shredded recycled paper is quite dusty. So the first instance is to change all your bedding for a paper that's not dusty at all. Remember never to use any wood shavings. The pine and the cedar are very bad for rats, so you don't want to use that at all. And we find another thing that's very common, especially in the older rats, is osteoarthritis. Like people, their joints and spines start to wear, and some rats will develop HLD, which is hind leg degeneration, which is a nerve damage caused by the all the bones wearing away, and it compresses the nerves. It can actually cause paralysis of the back legs and tail. Once the rats have got that, they won't actually feel any pain, but they will have some mobility problems. They'll start to drag their back legs. They'll have difficulty climbing. It's probably best to have them in a one-level cage, make sure they can reach everything, and keep an eye on them when they're out of the cage so they don't have falls. And I think if it's just the arthritis, there is a painkiller called Metacam available from vets, but not to use with rats with kidney disease. And I think the other thing that you may need to do with the HLD is to actually maybe clean the rats if they can't get to their back legs to clean. So we will either use a soft cloth and some warm water, or we'll hold the rat into a bowl of shallow water. But whatever you do, don't let go of them, because their mobilities make them wobbly. You don't want them to go under the water. And we also find if they can't actually groom themselves, that a soft toothbrush is quite handy. We can just brush the hair on their back and their legs for them to keep them nice and clean. Eye conditions, another thing that some of our rats have suffered from. Cloudy eyes is usually cataracts, and the rat will go blind. So you need to watch them very carefully when they're out of their cage. And inside the cage, don't move things around. Keep things where the rat knows where they are, and they will manage very well. And swelling of the eyeball can be several things. It could be a tumour behind the eye or in the brain, or it could be an actual glaucoma, which is a pressure in the eyeball. And we've got a rat, Rosie, who has that, and it's treated quite simply with eye drops. Heart failure is another problem that rats can have when they're older. If you notice your rat's tummy is swelling quite rapidly, like one day it might look a little bit swollen and the next day it's very swollen, you need to get to the vet straight away, because this is a sign of heart failure. And also the rat may be gasping for breath, or panting, or breathing with their mouth open. They're not getting enough oxygen in. Now that's usually treated with an immediate injection to disperse the fluid, just a tiny injection with a diabetic fine needle. They don't usually feel that at all, but it helps to relieve the symptoms. And that will be followed up with 2 different tablets, one to get rid of the excess urine, and the second one to regulate the heartbeat. Now, it doesn't always work, but it's worth having a go. The actual tablets are quite cheap because they're quite small amount for a rat. Obesity can also be a major problem and can lead to other illnesses. So if you have greedy, overweight rats, cut down on the sweet and the fatty treats. Try and get them to have more exercise outside of the cage, because you don't want them to develop diabetes or heart problems or strokes and high blood pressure. If they are drinking a lot and weeing a lot, very wet bedding and weight loss, that could be diabetes, but it could also be a kidney problem. So the best thing to do is to put them in a cage on their own, plenty of water, a little treat to make them thirsty, get a little syringe from the vet or an online vet store, and collect a little sample of urine, take to your vet, and they can just put a little dipstick in and see if there's sugar or infection at all in the urine. Stroke is a really nasty thing that can happen to rats. We've experienced it a few times. Rats can have mini strokes where they can manage quite well afterwards, or they can have severe strokes, in which case it's much kinder to take your rat to the vet and have them put down because they will have no quality of life. But if your rat suddenly gets very wobbly and the head's hanging down or tilting to one side and they have paralysis in one or more limbs, they're not able to hold food or to eat properly, you need to get immediately to a vet because that's a really unpleasant thing for them to have. Rats can also have seizures, and there's lots of things that can cause seizures, tumours, brain tumours, epilepsy, so it's another thing for your vet to diagnose. Any bleeding from any part of the body could also be internal tumours. And kidney disease, probably the most common thing that we've come across, or chronic renal failure. We've also had rats with urine infections where they've had very smelly urine and pink stained, and that's cleared up with antibiotics. But if they actually have kidney disease, which is quite common from 18 months but can start earlier from 12 months, you need to get to your vet and see what they recommend. But it's best to try and prevent kidney disease by putting your rats that are over 18 months onto a low protein diet. Some people start the low protein diet even earlier, so that's something for you to do some research on. But the symptoms of kidney disease are sudden rapid weight loss. They can look very shrunken in around the stomach area, and that is dehydration. They may be drinking a lot but they're not absorbing the fluid. Lethargy, constant drinking and very wet bedding. We've only seen this in rats over 2.5, and it's usually been very sudden and very severe and resulted in we've had to take the rat to the vet to be put to sleep. There was nothing that could be done, so I don't know too much about the actual treatment options. It's something you need to discuss with your vet. Euthanasia is always going to be the last option, and we are going to recommend. We cannot agree with any type of home euthanasia. It isn't right to do anything like this at home. You need to go to a fully qualified vet in the vet surgery and have the rats put to sleep nicely and kindly. There are mobile vets that will sometimes come to your house, but always a fully qualified vet, and always make sure your rat is sedated first, either with some general anaesthetic or a tiny injection under the skin that they won't feel with a diabetic needle, to put them to sleep so they do not feel the final lethal injection. You do not want anyone sticking a big needle straight into your rat's heart or lungs or anywhere else. It's cruel and it's unkind and it's not humane. And I will talk more about euthanasia in our very last part of this series. But that's all I can really say for now. So I'll talk to you again soon about tumours and other infections.